Hi everybody, welcome to my channel. I'm Stacy. If you're new here, welcome in. If you're coming back, I'm glad to have you. Let's talk about managing the flu and COVID and all the things. We talked a little bit about flu vaccines. Let's talk about the flu. Let's talk a little bit about COVID. Let's talk about these things. If you like what you see here, I ask that you like, subscribe, and follow. Let's get into it. So what are some symptoms that we have to watch out for when we're talking about the flu and the COVID, when we're talking about home hospice patients? We want to make sure that during flu season, we're reviewing these things with our patients, that we're reviewing, hand washing, hand hygiene, that we're using good hand hygiene when we're giving care. This is maybe redundant, but we want our patients to be aware of symptoms to watch out for and what to report to your nurse. In hospice, it is important that our patients know they have 24-hour access to a nurse hotline where they can be triaged, maybe walk through some symptom management, and if necessary, have a nurse come to see them in between their regular nurse visits. So it's very important in hospice. The patient's goal is to stay home and comfortable at home. Our goal is to try to protect them from getting infections. Unfortunately, though, sometimes people are going to come into contact with things like the flu, things like COVID, and they are going to become infected with those things. What do we do? How do we manage that? That is the topic today. When a person has the flu and they tell their nurse, a lot of times in home settings, we are not doing rapid tests. We're not doing labs. We're not doing things to confirm. We're basing it on symptoms. So we really want to make sure that our patients know. And a lot of times family members are testing themselves and getting tested for flu or the COVID, the flu or COVID, the COVID. That's great. But they have done rapid tests sometimes at home too. So it's okay if people are testing themselves at home with rapid tests, but in home hospice, we're generally not doing that. But if we have a confirmed case of flu or a confirmed case of COVID, then we will treat accordingly. Some people do still see their primary care doctor and get treatments. It's just important that we're all on the same page with how to provide care when a patient is having the flu or COVID type stuff. You just want to be present for your patients. Apologize for saying so much. You want to be present for your patients. You want to make sure that they're comfortable. And that means things like making sure that they have some of those medicines that help with coughing, making their cough productive, things that suppress cough if necessary, if they're having like a significant amount of coughing and they can't rest. We want to make sure that that we're providing fever relief in the way of over-the-counter medications when necessary. In our comfort kits, we often provide Tylenol suppositories. We often provide our patients with Tylenol when necessary. Tylenol and ibuprofen are very commonly used to combat high fevers. What is a fever? Well, I think a fever is different for each person. I think the standard is that if it's 2 points above what it normally runs for so many consecutive days. Let me just get this out of the way. I'm not a doctor. What I'm saying is not medical advice. I'm just sharing my experiences as a nurse and things that I have been taught over the years. Please always consult a physician and do your own research. Let's get back to that. So things that we want to prepare our families for if a patient is experiencing the flu would be things like fever, chills, weakness, cough, sleepiness, loss of appetite, less responsive, shortness of breath, sudden weakness, a fever over 100.4. So that is the standard, is like a fever is anything above 100.4. Again, I have family members who feel horrible at 99.9. So it really is individual to also what your temperature is running on a regular basis as well. You always want to have your patients know that they should reach out to their nurse with these types of symptoms as they're coming on. You want to make sure that you're encouraging your families to hydrate the patients at home. In hospice, in the home setting, we're not doing IVs generally. I mean, there are like open access programs where IVs are happening, like antibiotics and things like that short term, but generally in a home setting, we're not giving IV fluids in the home. So what we do want to encourage is offering fluids. There are things that you can encourage, like Gatorade, there's liquid IV. These things will replace electrolytes, especially if there's vomiting involved, because vomiting can happen with the flu. You want to make sure that people are not bundled up too warmly when they have a fever, that they're not covered up in heavy blankets, because that can just make the fever higher. So you want to encourage them to wear light clothing, to light blankets, and I generally will pull back those heavy covers. You know, some people believe that we should just bundle them up and sweat it out, and really it's just better to cool them down. And that can be done with cool washcloths on the forehead, the wrists, and the neck, behind the knees. Any kind of pressure points, you can put cool cloths there and change them when they become warm. Another thing is rest. You want to encourage people to rest when they are not feeling well, that they need to rest well. And in order to do that, they may need things like Tylenol and ibuprofen to manage those fevers. You want to help turn and reposition them every couple of hours, especially if they're weak. You want to make sure that you keep their lips moist with things like chapstick. If they're on oxygen, obviously we're not going to use any petroleum-based chapsticks or moisturizers. We want to use water-based things if there's oxygen involved. So a good chapstick to use when you're mouth breathing and you're on oxygen is Burt's Bees. It's something that I've seen recommended many times, and something that I've researched on my own as well. And I do recommend to my patients a lot of times, especially if they're mouth breathers and their mouths are dry, Burt's Bees is a good chapstick to use. Also, in drier climates, like desert type climates, I often recommend a humidifier to help keep the air moist. In places where there's a higher level of humidity, you often won't need a humidifier, but there are certain times of the year when the humidity level goes down and you may need a humidifier in the room to help provide moisture. Another thing is you want to try foods that are not going to be harsh for a patient. Soups, soft foods, light, clear things. Again, because with flu symptoms, sometimes you can experience abdominal discomfort, you can experience gastrointestinal symptoms. So you want to be giving your patients soft things and encouraging soft things. When you are going to see your patient and they have the flu, something to keep in mind when you have somebody who is on droplet precautions is that maybe you should put that patient toward the end of your day if possible, so that you can avoid taking their flu to other patients that you have to see throughout the day. I will often tell my patients when they're in an isolation situation where they need extra precautions, I will tell them, hey, I'm going to come see you in the afternoon rather than in the morning like usual. Is that okay? Sometimes we can't move our patients around, so it's just best to make sure that you're wearing good PPE, that you're wearing your mask, your gloves, and that you are washing your hands and providing yourself hand hygiene as well. You want to make sure that you're washing your hands, whether that be with soap and water or with a hand sanitizer that's alcohol-based, between interactions and between cares. You also want to disinfect things. We don't want to take our bag into a home where we're taking care of people that are on isolation precautions, just some equipment, and we want to make sure it's equipment that can be wiped down with sanitizing wipes. I know my companies that I have worked for often do provide the purple top wipes for us to disinfect our equipment with. We also have barriers that we can put down that are permanent barriers, but I would recommend when you're going into a home where there's isolation precautions that you maybe have a separate set of equipment for that, and that you put it in a bag and you don't carry your bag into the home. You want to encourage them to limit the amount of people that are coming in and out of their home, and tell them not to bring little children into the home during this time, not to bring other people that are susceptible and more vulnerable when they get an illness. You want to make sure that little kids aren't coming around, that a bunch of people aren't coming and visiting, that we limit that interaction to prevent the spread of infection in the community as well. Isolation, I want to say this, it doesn't mean that your patient has to be lonely. It just means creating safe closeness. So you want to hold hands with gloves. You want to teach your family members about washing their hands and sanitizing their hands. that they can play music for the patient to help them relax, reading stories to them if they like. You know, hospice care is about comfort and dignity, and even during illness, we want to keep that spirit alive. We want our patients to still feel connected to the people who love them and not to feel cut off. Isolation is so hard for patients because I remember I had a patient who had VRE, off subject from the flu. I had a patient in a facility with VRE and she just couldn't get rid of the VRE. This is so many years ago, so many years ago. And we had to close the door. We had to gown up and glove up. You know, VRE was a big deal and we didn't want to take it home to our families. C. diff's another ones of those things that kind of isolates our patients. Just off topic, I'll talk about isolation precautions in another video. But we want to make sure that our patients still feel connected with us as their caregivers, their nurses, their CNAs, and with their family members. You know, we just want to provide that care safely without spreading more infection to other people or without taking it home ourselves, right? So you want to show your family members how to put on and take off protective equipment. You should encourage them to wear a mask. You should encourage them to wear gloves. If they're giving, you know, up close cares, you might provide gowns. We do have disposable gowns that we can put in the home to provide for that kind of interaction. You want to teach them how to put it on and how to take it off and when to use that. Yes, for droplet precautions, we do want to use gown, gloves, and masks. And if necessary, sometimes we need goggles if there's like a lot of sputum and coughing. And especially sometimes you'll encounter trachs. And so you want to think about how far, I don't know if you've ever taken care of a trach, but those things, if you have taken care of a trach, then you understand how far droplets can really go, if you think about it. And I've watched videos, and I encourage you to watch videos about the flu, about droplet precautions, so that you have an understanding of why we do what we do. So, in summary, you want to change your gloves in between tasks, you want to wash your hands, you want to wear the proper PPE, and you want to get rid of that in a separate trash bag. And, you know, in home care, we can ask our patients where is their trash receptacle so that we can leave that in their trash receptacle when we leave outside, like in their trash cans if possible. You want to make sure that you have a clean and dirty area in your car. You want to make sure that you're trying to save that patient for last when possible, but we also want to always provide compassionate care to our patients and let them know that they're not alone and they're just a phone call away, that they have access to nurses 24/7. They can call the triage line. A nurse can come see them when necessary, and we want to be there for the families because it's scary when our hospice patients do get sick. So I think in closing, I just want to say that it is just really important that we protect our patients and ourselves during the flu season and any other time that we are experiencing illness. COVID, as we know, is droplet and airborne, so there are completely different precautions that are involved in that, but COVID symptoms have really evolved over time. Moving from the flu to COVID has evolved. When it first came out, we didn't know much about it. It was spreading like wildfire. So we do need to be wearing an N95 when we see our patients. We do need to be wearing, you know, face protection. We do need to be wearing a gown and gloves. And COVID patients really should be at the end of our day when possible, just because it's better to not spread that around to your patients. We are seeing people live through COVID and live through the flu. But it is just really important that in providing that safe, compassionate care, that we are thinking of our other patients as well and trying not to bring that to their homes and their families. And one of the things that I have done when I have a COVID patient, myself personally, is that I will take my shoes off. I never wear my work shoes into my house walking around. I don't wear my shoes in my house in general, but I never wear my work shoes into the house. And when COVID was happening, I would often strip in the doorway and put my clothes in a bag directly. And they do make Lysol sanitizing laundry soap now. But of course, I came from a day and age when you'd get the brown bottle of Lysol and wash your nursing uniforms in that. I will say I never brought COVID to my family, and I never experienced COVID myself during the time that COVID was at its worst, and I was heavy into the facilities that were impacted, and I had given care to many patients with COVID. So thankfully, I never experienced that. I would love to hear about your stories, though. What is your experience been with your patients with flu? How do you handle that in your day as a home care nurse, as a home care CNA? What are the things that you're doing to protect your patients? How do you feel about COVID? Are you wearing the full gear, or have you noticed that you feel a little bit more lax since it doesn't seem as big of a deal these days? I just think we should talk about it in the comments, and let's chat about it. But I will say to you that COVID is still a big deal. The flu is still a big deal, which it's always been. And we still do see deaths that are related to those viruses. So I would encourage you to wear your PPE, and I would encourage you to not avoid your patient because of having to be in isolation. And that's it. If you like what I say, if you want to see more, if you want to talk more, I encourage you to like, subscribe, and follow. And I hope to see you soon. Thanks for watching. Bye-bye.